Interesting story about Ryan Braun that's in the news. It involves something called cryo something. Can you help us with that?
We talked about it at spring training. Actually, I talked with Ryan about the procedure where he had, it's like a surgery, but you're awake through it, and they essentially inject extreme cold at the location of the nerve. And the idea is to stun the nerve and basically inhibit the pain that you're getting from it. If you guys recall, he had this intractable pain from this thumb that was giving him problems at the plate. He was having to pull his hand off the bat, couldn't swing. He said this was so great, he felt it right away, the relief, was able to swing a bat in a week, and was back playing. But now, apparently, he's had a recurrence of some of the pain, so we heard he went out, had a second cryotherapy procedure. I spoke with Ryan and his surgeon this spring, and they said it would not be unexpected to have to do this again. They didn't expect necessarily.
What happens?
I think that's probably the best way of explaining it. But the idea is you're not killing the nerves, and nerve has potential at the little endings there to essentially regenerate itself. So it can come back and cause pain. Sometimes they have to do it 2 or 3 times. They've never done it in the thumb before. Ryan was really the first test case for this. But in similar pain management situations, sometimes it takes a couple.
Where would you do that? I mean, knees, ankles, where would you do it? Because it sounds like, you know, if I need to get through a week,
knees.
Let's cryo this thing up here.
That's a good example, is in the knee. This is very new. It apparently came out of Europe, used with cosmetic procedures in Europe. And so this is a fairly new treatment in the United States. But this physician at the Curlin Job Clinic has used it for pain management in certain types of patients. And then they tried it with Braun because nothing else was working. We talked about it with Adrian Beltre, you know, sometimes you can use the pads around the thumb to help protect.
Is it along the same lines as the spray that they would spray on when you got hurt? That would numb?
That might feel good on the skin, but you're not getting in there right to the nerve. And it's in that, like, web space, they call it, between the thumb and the index finger. Very difficult to get. But Ryan said it was really cool. When they did it, he got the relief right away.